Gregory has always made music from the heart, but in January of 2013, a heart attack caused him to skip a beat.
Having a heart issue didn't surprise me that much, but having a full-blown heart attack did surprise me. I've had really low cholesterol for all my life, the total numbers. My dad died of a heart attack, but he was 76 when he had his first heart attack, 10 years older than I was.
That's why when Chris first started experiencing subtle symptoms, he was concerned but not alarmed.
I did not have the elephant on your chest feeling that I've read about. I just had radiating pain, which concerned me a bit.
By the time his wife drove him to the emergency room at LewisGale Medical Center, the symptoms were getting progressively worse. But Chris says even an EKG showed no major red flags.
It just happened that Dr. Prokopchuk was walking down the hall and the ER doc said, "Come here, look at this guy. He seems to be having a heart attack, but he doesn't have any dramatic symptoms that would make us rush him anywhere." And Dr. Prokopchuk walked in, looked at the monitor and said, "This guy's having a heart attack. Get him to the cath lab now."
Within a matter of minutes, he was in the cath lab.
25 minutes later, it was over with, and I was just about asymptomatic. Just really felt good. I could have walked home that evening.
Chris says the quick action of Dr. Prokopchuk and the LewisGale staff and the 3 months he spent in cardiac rehab made all the difference.
Here I am almost a year down the road, feeling great, still going to the gym 5 days a week.
I started working on a computer. Next thing you know, all I remember is falling down, hitting my head on the computer keyboard.
Lorraine Eisner considers herself lucky to be alive and doing so well, especially considering what happened to her last January.
All of a sudden, my daughter realized I couldn't move my left hand, or even my left side. And that's when she says, "I think she's having a stroke." So then they called 911, and when EMTs were there almost immediately.
At LewisGale Medical Center, doctors confirmed she was having a stroke and recommended she get TPA immediately, a drug used to dissolve clots. Her family agreed, believing it was her only hope.
If they didn't, I could have wound up being a vegetable, because I had several severe strokes at that time.
Even after the TPA, Lorraine still had a long road ahead of her.
I couldn't walk them down steps. I couldn't walk without being dizzy and woozy. And of course, I couldn't drive. And what else? I couldn't do just about anything. I was pretty well an invalid.
She credits weeks of therapy at Lewis-Gale for getting her back on her feet and for the life she has today.
But now, I drive myself to the store. I go to the library. I go outside with my dog. I do anything I want to do right about now, just about. Oh, I feel great. I really do. I feel good.
And Lorraine says she is forever grateful to the EMTs, nurses, doctors, and therapists who cared for her along the way.
I cannot thank them enough for saving my life. They saved my life. They gave me a quality of life back.
At 75 years old, Louis Shontell is serious about staying in shape. He was actually preparing for a fitness competition when he almost died.
It was an absolute surprise.
He was in the garden at the time helping friends plant a tree when he fell face down and went unconscious.
One of my friends picked up his cell phone and dialed 911, called the rescue squad. When they arrived, he tells me that they stimulated me 4 times with cardio shock before they could get me stabilized, put me on a stretcher, and get me off to Lewis-Gale Hospital.
It turns out he was having a heart attack. At Lewis-Gale, he underwent therapeutic hypothermia.
My friends tell me, that I was ice cold. So evidently, I must have been chilled down, to reduce, body metabolism and to keep oxygen supply up, so I wouldn't suffer, brain damage.
Lewis would also end up having a quadruple bypass. Today, he is thankful to be alive.
The expert care, the immediate care in the emergency room, the rescue squad that brought me to the emergency room, the treatment that I got in an intensive care unit must have been superb. I have 100% recovery. I take a small amount of medication, 2 little pills twice a day. That's all there is to it.
And more than a year later, he's back to his old self again and his garden.